Okay, good morning. Looks like we're live. Welcome to today's webinar from Dexco and Weld Health. Next slide, please, Sarah. I am Wendy White. I am the Chief Marketing Officer of Dexco. And joining me today is Cassandra Stish from Chief Customer Officer from Weld Health. And we're going to take you through a very skim the surface overview of PII and PHI, and you'll learn what those terms are in a minute. I think the thing I want to emphasize is we're going to go fast. We're going to share a lot of information. You can ask any questions at any time, and we'll interrupt and honor and try to watch the Q&A so that we can interact with you as needed. And do not worry, you're going to get all of this information after the event today. All right, next slide. So again, here we are, our smiling faces, and let's just keep moving on. All right, so before we get into Weld Health, I just want to emphasize, why is Dexco bringing this event to you today? Well, so first of all, Weld Health is an amazing partner, and you all have access to Weld through the Dexco Exchange, which we'll talk about at the end. But it's also part of just an initiative we have this year at Dexco to make sure that our Ys understand how we safeguard your data. We want to make sure you understand your data is your data. Our job is just to safeguard it. And that's through our policies, our practices, including how we partner with amazing partners like Weld to even protect it further when it comes to health data. So we're going to walk through this webinar. We'll ask questions as we go, and I will circle back at the end and talk to you about how you get access to Weld. And with that, I will turn it over to Cassandra. Good morning, Cassandra.
Good morning or afternoon, depending on where anybody is in the country. I hope you all are either had a good lunch or are currently enjoying one. I'm grateful to be here today to spend a little time talking about, PII and PHI. These are things that are close and near and dear to my heart, because in addition to being the customer officer here at Weld, I'm also the compliance officer, which means that, I take into consideration all the things that we do as a product company in relationship to your needs with regard to data protection. Now, sometimes when we hear data security, PII, PHI, HIPAA, and all of that, there's a subtle or maybe not so subtle inner cringing that might happen. It's often because we're wary of things that we don't understand, and especially if those things might come with, some large consequences if you get it wrong, right? So I wanted to start off with just a couple of kind of some questions that sort of frame up, where are you with regard to your understanding of PII, PHI, and what you guys might be doing or not doing, or maybe want to do more of to protect it. So what sensitive information are you currently collecting? Do you have a current protection plan? Do you know if you even need to have specific, like actual HIPAA controls in place? Or are you doing something a little more lightweight? And just what is the difference between PHI and PII? So let's go ahead and explore. Take it to the next slide, please. And this is where the slides get a little meaty, guys. So just heads up, it's a heavy lunch. Next slide, please. Oh, sorry, you're on there. Okay, so personal identifiable information. This is like the first line, right, of information that you collect. And its PII is commonly referred to as information that is used to distinguish or trace an individual's identity, either alone or when combined with other personal identifying information that's linked or linkable to a specific individual. Basically, anything that can help somebody figure out or pinpoint who a certain individual is from your records equals PII. So here's a really good laundry list of examples of PII on this slide. I'm not going to read them all. You can see it's pretty exhaustive, but something I want to call out about it, and you might recognize this from some of your normal member onboarding. When you're creating a new membership, almost everything in that record is a piece of information that is considered to be PII, okay? There's, you got social security numbers, you might have a driver's license number, you might definitely have first name, last name, address, all those sorts of things, a credit card. All of those things are considered to be PII, especially when they're in combinations. You've got multiple pieces of this information on one single record. This is classic PII example. And, it's like, well, we have some examples of PII which are made public, right? You think about maybe old phone books, if you're old enough to remember using those. those things are common. You have a first name, you have a last name, maybe a little bit of an address and a phone number, right? But those are considered to be, public PII that are sort of used for the common good and the common, just for society to work. But when you start layering in additional things, or a little bit more private, like driver's license numbers and those kinds of things, they start tipping into that realm of things that you might need to be protecting. PII is widely stored in your DAXCO products at your organization. Carry on to the next slide, please. So if we're talking about PII, and then now we're tipping into PHI. So PII is collected and stored on a health record, right? Like weight, maybe BMI, blood pressure, medical history. Maybe you're collecting a little bit of medical history on your PAR-Qs. That collection and storage of all of that together in one place constitutes a health record, right? So you've got PII plus some health information kind of coming together in one place. Now you've got a health record for your members that you got logged or stored somewhere. HIPAA data is HIPAA is a privacy rule that was adopted in 1996 to protect and preserve health information. It defines PHI as data that relates to the past, present, or future health of an individual. It is also related to the provision of healthcare to an individual. In your cases, while you guys might not think of yourselves as clinicians, I would say that YMCAs, JCCs, and the like are most certainly in the business of healthcare if you are providing things like health coaching, lifestyle coaches who do DPP, if you're doing the Livestrong Cancer Survivor Program, if you're doing a fall prevention program, you're doing those pre and post assessments for those programs, you're collecting health information with PII, some health metrics, some health benchmarks, the production of those programs. That equals HIPAA data, okay? Because you at that point are now in the provision of healthcare. You're part of the treatment cycle. Also can be construed for the payment or for the provision of healthcare. So if you further have a third-party payer, whether it's an employer or an insurance company who's covering any of those services, now you're again in the HIPAA covered data world with regard to this health information. Healthcare operations deal with sensitive details about a patient, including the birth date, medical conditions, and your health insurance claims. And whether you've got paper-based records or electronic-based records, make no mistake, you are collecting and maintaining, storing and controlling HIPAA data on premises. So I want to take a minute there and say that there is like a little bit of a line, okay? So we have this idea of a covered entity and a business associate, right? And I can get my notes to open more here, hold on. We have a covered entity and a business associate. Covered entities are obvious, right? Your doctor's offices, your pharmacies, your clinics, your health plans. These are folks who clearly engage in a day-to-day basis with HIPAA data because they transact business in healthcare all the time. But what we're talking about today is where your organizations, your Ys, are tipping into that space as part of the continuum of care, right? So maybe a medical referral is coming into your door for someone for a cancer survivor program or diabetes prevention program, in which case you would be considered a business associate of a covered entity, right? So the covered entity is the clinician, and you are now an associate who's working alongside them for the care of that patient. And you're going to be receiving information about that patient, doing some service, and providing information back to that referring provider about those services. You are now part of that healthcare continuum, which is most definitely covered from end to end by the HIPAA rule, okay? So whether or not you're taking insurance doesn't necessarily protect you from the strictures or the structures of the HIPAA statute. Business associates are, if you think about it, they're like the wraparound services that might support a clinician in the transmission of care. So a clearinghouse, and you can be both, right? It's like you can see how organizations might be both, and sometimes they're both in the same context. You're wearing both hats at the same time. A business associate is like Weld. We would come alongside your organization and sign that BAA agreement with you that now allows us to be your data platform to collect and store the HIPAA data that you've been receiving from your clinical partners who are the covered entities. Right? You start to see how this creates the chain of accountability around which HIPAA data is protected. And of course, the HIPAA rule is really good at defining all the way through it everybody's roles and responsibilities. And this business associates agreement is like the best place to go find who does what, in the course of transacting these things when we're working together with health information. So again, before we leave from this slide, PHI is a combination of PII plus health data together. Okay. Health data in and of itself without any identifying factors does not constitute PHI. If you've got just a bunch of de-identified health weights and blood pressures and different things like that, kind of tracking maybe population health outcomes without any identifying information, that is not HIPAA. But it's when you put it all together with that personally identified information, essentially create a health record, that you are now tipping into that space. Next slide, please. So now that we know that when certain information is all combined together, right, to create a health record, here are some examples of the types of things that get combined, right? And you can start to see, you're recognizing on the left column, there's a lot of information that exists probably on your standard record in DAXCO for your member, right? But then you tip over into what might happen in a health record, which would be something that's stored in a platform like Weld, or maybe for some of you who are using REDCap still to collect your information, right? This is where the health information is stored. These two things together create a health record. So certifications, license numbers, vehicle IDs, all that stuff, not necessarily health information, but you can see how it tips into a slightly more personal and particular pieces of data that are more protected. Full face photographic images, by the way, biometrics and all that. There are some new rules around that, which we're going to talk about in a second. But I just wanted to point out that if you guys are offering programs like Exercise Medicine, any of the fall prevention programs, the cancer survivor programs, diabetes prevention, even some of the weight loss programs, if they're in combination with a medical referral, right? Do you offer intentional goals-based onboarding where you're collecting a baseline measurement of maybe a weight, a blood pressure, or those types of things, and tracking outcomes? Those types of activities fall under the treatment category of services that HIPAA protects, right? So if you provide outcomes back to referring clinicians, you are most definitely staying inside that swim lane and making sure that whole end-to-end data collection, storage, and transmission back to a covered entity is protected. Next slide, please. So privacy and liability for fitness coaches. Well, I think probably some people on the call are thinking, well, I just collect a little bit of onboarding information. I'm just collecting a weight when they start, and maybe we're doing an in-body scan to give them something to go by. As long as it's being handed to that individual and you're not storing it, you don't have to worry about it, right? But if you're trying to pull data in to your organization and store it and capture it for the idea of tracking and measuring your outcomes, then you probably need to be thinking about, how does your privacy and liability protocols at your organization extend out to fitness coaches? And I put fitness coaches here generally really broadly because I want you to think about it for personal training, for your onboarding folks, and then also out into any of those registered dietitians you might be working with, or your lifestyle coaches that do DPP. Those things are a little bit more intentional, or feel like they're a little bit more classically related to chronic diseases. But an organization like a fitness center or a YMCA is very much 100% in the healthcare spectrum, from membership all the way through to chronic disease management, if you're measuring outcomes. So anyhow, one best practice to consider avoiding any liability around data collection and working with this data is, do you have a compliance officer, or do you have a data security champion that's there at your facility who can help design a comprehensive plan that will serve your center and your members for the years to come. This is a really good way just to start, assess what are we doing, what are we collecting, where are we storing it? Do you have a regular compliance review, right? Annual security audits are really good. Document that you do those. A document retention and secure disposal protocol. I know that recently there was some case law that came into my attention where an organization with they had a gym, right, with all those bins of the exercise cards that were just available for anybody to open and go find their own and record your stuff. Well, they just said, this is actually a lot of really personal information that's just being left wide open in these unsecured folders. Anybody to go rifling through to look at somebody else's data. They're saying, you can't do that anymore, right? So it's like there's this level of, we're all leveling up. We're all being more mindful about how we're protecting information. So you guys might want to think about, where are you storing that stuff? And do you have a secure disposal protocol? Electronic data security, in the cloud, that would be Dexco and Weld or Dexco and RedCap or something else, whatever it is that you're choosing to use. Just make sure that you understand your technology partners' ability, read the contracts about who's responsible for what. Is a BAA required? Have you signed one? Who does, all of those things. Step into this with a little bit of intentionality and your eyes wide open. Health and Human Services, HHS, has some really great, easy to read, really, actually. They've tried to make this simple, it's very human readable. You can go on their website and just look about their guidance on data protection and what are some things that you can do to implement and make sure you've got a good protocol in place that protects you and your members both. And then you might want to consider just having a little bit of liability insurance that is specific to this, including some sort of a cyber policy if you don't already. While we all like to think about the happy path, we do know that sometimes things happen by mistake. We're not going to say anybody's a bad actor, but this is a world where there's a lot of potential for a cyber attack or spoofing and phishing emails that result in some unfortunate circumstances, and it's probably good just to make sure you've got some coverage there. I want to take another little quick pass and to mention about biometrics on this particular slide, just because it is a growing space with regard to case law and protection, and more states are adopting some version of control, right? So biometrics and baseline health data, even exercise data, even data regarding sleep, exercise minutes, how often are they running, RPE, all that stuff that we kind of have classically thought of like, well, that's not really health data, is it? Is now becoming to be considered health data, or at least biometric data that falls into a protected class of data. So even your personal trainers who might be collecting and storing to help your members follow their journey through their training package to see their impacts. If you're collecting and storing it someplace, you're probably falling under this category of like, gosh, if we're measuring sleep, that's actually protected information. So, just because it's not, a lab from a doctor, or we're not doing classic medical things with an insurance payer, or we're not sending claims off, to Medicare to be processed, that doesn't mean you're out of this space. So just to let you know, California was the first to adopt the Biometric Information Privacy Act, which BIPA, we got HIPAA and BIPA now. And recently we've had Illinois, Texas, Washington, California, New York, Arkansas, Colorado, Connecticut. All of them are starting to adopt similar policies that sort of take HIPAA and just extend it out to say, you know what? HIPAA's here, but we recognize that there's like this other band of data that probably needs our attention as well. And so those things are starting to come into play. It's really good if you can work with a partner that understands them and can sort of streamline or help you get out of the ground with it. HIPAA Secure Now is something that YUSA has advocated for largely over the past several years, if you're not using them already. They're a really great tool that can help you set up a plan. They've got some good templates and some checklists and things like that to kind of help you develop and then make sure you're maintaining that plan from year to year. So if you haven't checked into that resource yet, I highly suggest that you do, just because it'll give you some peace of mind, right? It's not we all need more work to do, but we certainly all want more peace of mind. Next slide, please. So because this is a lunch and learn, I'm trying to get out of here before everybody's half hour is up. We have this little, just a quick, this is like, I took all that information to boil it down into this 2 simple things. Does your nonprofit need to be HIPAA compliant? And while HIPAA compliant is sort of like I think of this as a blanket statement. Does your nonprofit collect health data, and do you need to have some sort of security measures around it? Is kind of what we want to talk about, right? So yes, if you receive referrals from a medical professional, if you're collecting and storing health information on your members in a health record, weight, blood pressure, heart rate, etc., if you're submitting claims or invoices for payment to insurance companies, then yes, you really should be having a rather robust, somewhat hardened, and operationally, it should be transparent. Everybody should know what the SOPs are. If there is a breach, if there is a problem, what do we do? You know, all of that stuff should be dialed in. No, if you are processing only third-party payer memberships, like, okay, so if you're doing insurance-based reimbursements for memberships, those don't count, okay? There was a actual exclusion written by the lawmakers that said, yeah, we don't think check-in data is HIPAA data, mainly because you're not using the health insurance policy ID to track that person. Ergo, Silver Sneakers and Optum and all those guys are aggregators. They hold the policy ID. They create a fitness benefit ID that then those members use instead of their policy ID. Therefore, check-in data, not HIPAA data, right? They've tried to just create that barrier for you, which is very helpful. If you're not collecting any health information and storing it, if you're not doing EBHIs or onboarding where you're collecting those baseline measurements and measuring outcomes over time, then no, you don't have to worry about it too much. And if you're not doing any medical claims or medical referrals, so if you're not getting in things in the door into your programs from any of your clinicians in your community, don't worry about it too much. So I hope that was like, you know, enough to get you thinking. This is a lot to think about. So if you're, you know, thinking about the programs you have offered or what's coming up on your strategy, or you're trying to get your program started back up again after the pandemic, and maybe you've lost some people over the last several years and are bringing in some new team members to get things going again. It's entirely possible that your old data handling protocols maybe need to be dusted off. You might need to identify who your officer is again. I've seen that happen in, I don't know, 8 or 10 different YMCAs recently, where the folks who were doing it previously have moved on, and now there was a vacuum. So, you know, institutional knowledge all has to be rebuilt and re-identified. All to say, while it sounds maybe a little bit scary, if you're engaging with members through programs that are tracking and measuring health outcomes, please know you're collecting information. And while these rules might seem a little daunting, I'd like to say that the reward from collecting this information is greater. Measuring the impact of your services from membership through chronic disease programming is critical for you to be able to tell your data story to a wide array of stakeholders, whether that's your members, your donors, your boards of directors, community impact grants, health plans, or employers. If you're not measuring it and tracking it, you can never tell your story of how you've done a good job as a good steward, as a good partner in your community. So please don't be scared of collecting the data. This whole idea today is to help you understand you are collecting something precious. It does need to be protected. It's not completely without a little bit of risk, but the reward is really great. And I do think it's one worth taking. And that's it for me.
Come off of mute. So, so much information, Cassandra, and probably very helpful for many folks here. We're going to open up the floor for additional Q&A. I see a few already in the Q&A. On your screen, you should see a question mark or a place for Q&A. If you could click that and put your your question in, we'll definitely address it. Before I leave the presentation, though, I did want to emphasize that you all have access to Weld through the DexGo Exchange. You can log on to your DexGo Exchange page and see if you have Weld activated if you don't know. If it's not, then just reach out to your sales team and we'll make sure to turn that on for you and get that into your integrations. The DexGo Exchange is a great way for you to understand your data, who's got access to your data, and make sure you're protecting your data. And now looks like somebody deleted their question, so I'm going to just keep my eye on the Q&A. One of you asked, is DexGo integrated with RedCap through the DexGo Exchange? And the answer to that is no. Our preferred partner today for health information data exchange is Weld. And so you'll see them available in the DexGo Exchange. If you have any questions about that or want to talk about a different partner, definitely reach out through the partnerships email, which you can find on the dexgo.com, which is partnerships@dexgo.com. Sarah is also going to be, as soon as we fully transition to the Q&A here, Sarah is going to be dropping all kinds of resources into the chat so that you can drop your, or you can grab them from there. You will also get them along with the slides and email tomorrow. All right. Okay. So looks like we've got questions coming on the chat and on the Q&A. So I'm going to go back and forth. Valerie asked this question quite a while ago in the Q&A. So I'm going to pop over to this one, Cassandra, which is, what if we code name the PT client versus using their real name on the documentation? Is that still a HIPAA violation, or is that under the umbrella of HIPAA if we're using a code name on the documentation?
Yeah, so blanking out or somehow obscuring someone's identity, like changing their name, might be good enough. You have to ask the question of, like, does it make it difficult operationally for you to continue to work without records when that person comes back? Is it hard to find them? How do you look them up? Those kinds of things. You got to balance that operational ease and use of, like, how am I accessing this record, interfacing with this person, versus obscuring their identity in a stored record. And that's the balance. I would say I've got some groups who are fine, which is like, blanking out that information and they feel like it's enough. But if you're leaving other things on there and your sample size isn't big enough, like as you say, there's a female who's this age and there's other potentially identifiable information, even the lack of their name might not be enough to actually obscure their identity. So I would caution against using that as a sole remedy to solve.
All right, Tim asks, is there a reason why we should keep the physical copy, the source document of any kind of intake or referral form from a physician? And he's saying physician activity readiness questionnaire or anything like that might be used whether kicking off a program. Do we need to keep a physical copy of that?
I wouldn't say you need to keep a physical copy as long as if you can upload a digital copy someplace and store it somewhere, and then you can securely shred those physical copies. If you do keep physical copies of any of that stuff on premises, please make sure they're in a locked, secure room, someplace where the file cabinet can get locked. That's generally, some groups like to kind of have those backups for a little while, and then they kind of move on maybe every 6 months or so, and they do a big purging of files that are so old. Yeah.
Okay, great. Chrissy asked the question, what is it that Weld does? She's being your straight person here and setting you up, Cassandra, to talk a little bit about what Weld does, because I think the audience wants to make sure they understand how do we use Weld?
Sure. So think about it this way. If DexGo houses your member record and all your member contracts, we are the health record for that member that sort of hangs off of it. We're always downstream of DexGo. DexGo is your source of truth with the member ID, all those things that are happening there. But then if they engage in any health services, or if you're tracking any health information about that person, log it in Weld. When we integrate with DexGo, so then all your utilization and things are flowing back and forth. You don't have to double enter the record, et cetera. but then the health information is protected in this other manner through our platform. And we support everything from personal training all the way through all the YMCA's flagship health intervention programs, and then a host of custom built protocols that many YMCA's have initiated themselves.
Okay. I see Sarah's been dropping the resources in the chat. I also see Broderick asked the question, how do I get to the Dexco Exchange page where I see whether we're using Weld or not? Broderick, I just asked my product team to like give me the explicit directions. If we don't get it before the end of this webinar, we'll just pop it into the email that we're sending you tomorrow with all the information. So you guys know how to go look at your Dexco Exchange and see which apps you're connected to or not. So considering I run that program, you would think I would know exactly how to say that. And now I'm embarrassed that I don't know how to describe the navigation from inside the product. So I will get you that answer and I will do better. I will do better. All right, let's see. Is there any other chats? Thanks, Wendy. You're welcome, Broderick. Let's see. How long do you need to keep health and wellness paper files until you shred them?
There's no specific rule I'm aware of like a length of time for data retention. But if, it all depends on if you're doing claims. If you're doing medical claims, like anything to Medicare, Medicaids, they sometimes tell you, like, you need to retain a document for 10 years. If you're not, right, this becomes part of your own operational SOP. And as long as you're documenting it and keeping up with it, it's fine. You can decide, we're going to keep them for 60 days. We're going to keep them for, for 2 years. Whatever it is, as long as it's consistent and documented and you're following through with your own protocols, you've built up what you can rely on. If you ever did have a situation where there was a breach or a problem, you could say, we followed our structures. If we have to change them to make them better, that's fine. But at least you've got something documented through keeping up with. That's like the biggest takeaway, is having a plan, sticking to it, and maintaining some sort of data integrity through that operational control.
All right, I have to say I'm always thrilled to partner with with Weld and Cassandra in particular. You were an amazing speaker for us at General Assembly and here again this morning. So I just want to say thank you for that. For everybody who joined, thank you. If you have additional follow-up questions, don't hesitate to reach out. We'll be sending those materials in the recording tomorrow. And we'd love to hear back from you on any questions or any help we can give you. And we'll happily connect you with Weld directly if you have any questions for them. So thanks everybody for your time today. Cassandra, amazing job as always. And have a great day, everybody. Thank you.
Thanks, everyone. Happy Valentine's Day.